Here's a Usmle style question on vesicoureteral reflux. A 3-year-old girl is brought to the pediatrician by her parents for a routine checkup. The parents report that the child has had several episodes of fever, irritability, and poor feeding over the past few months. The child has also been complaining of painful urination. Urinalysis shows positive nitrites and leukocyte esterase, suggesting a urinary tract infection, UTI. A renal ultrasound is ordered, which reveals bilateral hydronephrosis, and avoiding cystourethrogram, VCUG, confirms the diagnosis of vesicoureteral reflux. Which of the following is the most likely long-term complication of untreated vesicoureteral reflux in this patient? A. Chronic renal failure. B. Nephrolithiasis. C. Renal cell carcinoma. D. Hydronephrosis. E. Viral nephritis. Answer and explanation. Correct answer, A. Chronic renal failure. Vesicoureteral reflux, VUR, occurs when urine flows backward from the bladder into the ureters and possibly the kidneys. This can lead to recurrent urinary tract infections, UTIs, and hydronephrosis, swelling of the kidney due to urine buildup. In the long term, untreated VUR can result in scarring of the kidneys, leading to chronic renal failure. This is due to repeated infections and increased pressure on the renal parenchyma from hydronephrosis, ultimately causing renal damage and a progressive decline in kidney function. Why not the other options? B. Nephrolithiasis. While nephrolithiasis, kidney stones, can occur in some renal diseases, it is not a common complication of VUR. The primary concern with untreated VUR is renal scarring and chronic renal failure, not stone formation. Renal cell carcinoma. Renal cell carcinoma is a malignancy that typically affects adults, not children with VUR. There is no strong association between UR and renal cell carcinoma. D. Hydronephrosis. Hydronephrosis can occur in patients with VUR, particularly in severe cases. However, hydronephrosis is more of an acute manifestation of VUR, and it can lead to renal scarring and chronic renal failure if left untreated. The long-term complication is renal failure, not just hydronephrosis. E. Viral nephritis. Viral nephritis is caused by viral infections, such as HIV, hepatitis, or Epstein-Barr virus, and is not a typical complication of VUR. The primary concern with VUR is bacterial UTIs, which can lead to kidney damage if not addressed. Key takeaways: vesicoureteral reflux, VUR, increases the risk of recurrent UTIs, hydronephrosis, and renal scarring, which can lead to chronic renal failure if left untreated. Renal scarring from recurrent infections and backpressure on the kidneys can be a progressive cause of kidney dysfunction. Early detection and management, including antibiotic prophylaxis or surgery in severe cases, can prevent long-term renal damage. Let me know if you need